Hi, I'm Alice Wiseman. I'm Director of Public Health for Gateshead. So first of all, what I want to start off by saying is thank you to everybody across Gateshead for everything you're doing to keep yourself, your family and obviously your wider community safe. I am really sorry that this is so hard for so many people. As a mum myself, I know how hard it is to keep your family going during these difficult times. So if you are finding things hard, we will make sure that there's a contact number that you can call for support, whatever that support might be after this short clip. This is unfortunately necessary. The cases in Gateshead have been rising fast. Over the last 3 weeks, we've seen a fourfold increase in the number of cases in Gateshead. And I think what I'm most worried about is the increase that we've seen within our fabulous QE hospital. If cases continued rising in the QE at the rate that we've seen it rise since Boxing Day, we would quickly have more people in hospital now than we have ever had at any point during the pandemic. We think the speed of rise that we're seeing is to do with two things. Firstly, we know that there's been an increase in social mixing. It's very difficult to be out in the shops during Christmas shopping and not have lots of people around you. We also know that there is a new variant, and we've seen what's happened elsewhere in the country when this new variant, which is more transmissible, has taken hold. And so actually the important thing we need to do is act now. If we can suppress this virus, then actually not only does it protect people in our community, but it stops it having the chance to mutate again. And obviously we want to be able to take that time to focus on everything we can do to protect people across Gateshead. So during the next few weeks, whilst you are following the advice, whilst you are, minimising your social contacts and maintaining that important social distance, if you are out and about doing essential activities, during that time we will continue to provide support to protect those people in our community who are most vulnerable and most in need. But we will also look at how we can further localise the testing and contact tracing system so that when we come to a point where there are lower cases in Gateshead, we can have the greatest impact on keeping that rate low as we move hopefully into the spring. And of course, finally, and most importantly, we do know how this story will end eventually, and the important rollout of the vaccination programme. This is being led by a tremendous effort with our NHS partners, and as a local authority, we will continue to look at how we can best support them to make sure that we can maximise vaccination uptake across all of our communities and get rid of this dreadful virus, which has really impacted all of our lives for almost 12 months now. So thank you again for everything you're doing. Like I say, it's really hard, but there does feel like there's light at the end of the tunnel. It may be another few months, but if you can stick with us, then we can protect everybody in Gateshead and minimise the impact and harm that this virus has caused. Thank you.